Hello everyone, this is Dr. Madhusudan Rao and the program I teach medical students. Today I am going to talk on about the trigeminal nerve, that is fifth cranial nerve. Trigeminal nerve is the largest cranial nerve. Its nuclei are located in the upper pons. It has got three sensory divisions, that is ophthalmic, maxillary and mandibular divisions. Ophthalmic division of the trigeminal nerve receives its sensory information from the scalp, forehead, upper eyelid, cornea and conjunctiva, frontal and ethmoid sinuses, and dorsum of the nose. This branch of the trigeminal nerve uh, enters the cranium through the superior orbital fissure and ultimately merge in the trigeminal ganglia with the rest of the divisions of the trigeminal. Whereas maxillary division carries the sensory information from lower eyelid, conjunctiva, cheeks, maxillary sinuses, upper jaw and the teeth, nasal cavity and the lateral wall of the nose, upper gums, nares, palate, sphenoid sinuses. Then enters the cranium through the foramen rotundum and merge into the trigeminal ganglia. That of the mandibular division of the sensory nerve and trigeminal nerve receive information from lower jaw, lower teeth and gums, and the chin. This particular division of the trigeminal nerve enters the cranium through foramen ovale and ultimately merge in the trigeminal ganglia. So this picture shows the innervation of the different branches of the trigeminal nerve. You have got the ophthalmic division, you have got the maxillary division, and you have got the mandibular branch of the trigeminal nerve. And this picture shows the central process of the trigeminal nerve, which is a single root, which is formed by the three sensory divisions of the trigeminal nerve, which end in the glycerine ganglion and continue as a single root of trigeminal nerve into the pons to enter the cranial nuclei. These are the peripheral branches of the trigeminal nerve, that is ophthalmic, maxillary, and mandibular. And you see the glycerine ganglion, where all these branches of the trigeminal nerve they merge together. From their central processes of the bipolar cells of the trigeminal nerve, glycerine ganglion, they form the single root of trigeminal nerve, which enter into the brain at the frontomedullary junction, ultimately reach the nuclei of the trigeminal nerve in upper pons. What are these nuclei? You have got the three sensory nuclei in the pons. One is mesencephalic nuclei, spinal nucleus of the trigeminal nerve, and general sensory nucleus. Okay. Well, the central processes from these sensory nuclei cross to the opposite side and ascend into the medial lemniscus to enter the ventrolateral nucleus of the thalamus. From the thalamus, they reach to the area of 312 of the postcentral gyrus of the cerebral cortex. Well, this picture shows the various trigeminal nuclei in the pons, but for receiving the information for about the different modalities of the sensations. Mesencephalic nucleus receives the proprioception from the muscles of mastication. General sensory nucleus receives the information about pain, no, about touch and vibration. And spinal nucleus of the trigeminal nerve carries the impulses for pain and temperature. Okay, you have got the motor nucleus of the trigeminal nerve, which sends the efferents to innervate the muscles of mastication. Well, coming to the functions of the sensory nuclei, which I already described, general sensory is for the touch and vibration, mesencephalic nucleus for proprioception, spinal nucleus of the trigeminal receives the sensory modalities from pain and temperature. Okay, and we are going to test for fine touch, pain, and temperature, besides corneal and conjunctival reflexes. What is corneal and conjunctival reflexes? These are the superficial reflexes. The afferent is the ophthalmic division of the trigeminal nerve, and the efferent is the facial nerve that innervates the orbicularis oculi muscles. Okay, the motor cranial nerve nuclei of the trigeminal nerve receives its supranuclear fibers from both the hemispheres, and which in turn innervates the muscles of mastication. Okay, okay. Well, remember one point. When you stimulated the conjunctiva or cornea to elicit the corneal and the conjunctival reflexes, afferents are taken by the ophthalmic division of the trigeminal nerve. They cross to the opposite side and ultimately reach the area 312 of the parietal lobe in the contralateral hemisphere. The impulses from there reach the area of phase of both the hemispheres, and the efferents run in the corticobulbar fibers and ultimately reach the dorsal nucleus of the facial nerve, which in turn innervate the upper facial muscles, that is, including the orbicularis oculi. Okay, because dorsal nucleus of the facial nerve innervates muscles of upper face of both the sides. Okay, that's how it is. When you stimulate the conjunctival cornea for the corneal or conjunctival reflexes, there is closure of both the eyes. You remember this point. The afferent for these reflexes is the ophthalmic division of the trigeminal nerve. Efferent is the facial nerve. The response is closure of both the eyes. Then, coming to the motor nucleus. Motor nucleus of the trigeminal nerve innervates the muscles of mastication. Okay, and nerve fibers of the from the motor nucleus They run in the mandibular branch of the trigeminal nerve and carry the impulses for muscles of mastication. That is masseter, temporalis, medial and lateral pterygoids. That means motor innervation from the trigeminal nerve goes to the masseters, temporalis, medial and lateral pterygoids. Okay, as I told you, motor nucleus in the pons is innervated by the conjunctival fibers from both the hemispheres. That is true with all the motor nuclei of the all cranial nerves except the motor nucleus for the muscles of lower face. Okay, how do you test for the motor function of the trigeminal nerve? Ask the patient to clench the teeth and note the tone of the masseter muscles. Okay, that's how it is about the motor function of the trigeminal nerve and the sensory functions of the sensory nuclei of the trigeminal nerve. Well, this picture shows the section of the pons, upper pons. Got the dorsal left fourth ventricle. This is the flora of the fourth ventricle. You got the various nuclei of the trigeminal nerve and various sensory ascending tracts and the descending motor tracts. These are the pyramidal area. In this area, there is descending corticospinal and corticobulbar fibers. And this is the mesencephalic root of the trigeminal nerve. Well, this is the motor nucleus of the trigeminal nerve. This is the middle cerebellar peduncle, and there are different lemnisci. You got the medial lemniscus more towards the midline, followed by trigeminal lemniscus, spinal lemniscus, and the lateral lemniscus. These are the tracts containing the afferent sensory fibers. Then coming to this clinical importance of trigeminal nerve. Then we test for the trigeminal nerve for the general sense over the face. We test for the conrneal conjunctival reflexes, which I already explained. And you do for the clenching teeth test to know the function or the innervation of this particular muscles of mastication by the motor nuclei of the trigeminal nerve. That is, you are testing for the motor as well as the sensory functions of the trigeminal nerve. You test for the various modalities of the sense or the face and scalp and do the clenching teeth test in order to assess the function of the muscles innervated by the motor nucleus of the trigeminal nerve. That is motor component of the trigeminal nerve is tested by the clenching teeth test. And do the jaw jerk. Jaw jerk is exaggerated in the pseudobulbar palsy. That is, when the supranuclear fibers are damaged, that results in the exaggeration of the jaw jerk. That is a sign of upper motor neuron lesion. Motor nucleus of the trigeminal nerve receives the upper motor neurons, that is supranuclear fibers from the contralateral motor cortex. Okay, lesion in the higher upper motor neurons innervating the motor nucleus of the trigeminal nerve results in the exaggerated jaw jerk. Okay. Again, you remember the motor nucleus of the trigeminal nerve receives the upper motor neurons from both the hemispheres. Okay. Exaggerational jaw jerk is seen only when there is bilateral lesion, not for the unilateral lesion. Remember that. You will be seeing a lot of children with spastic cerebral palsy. Okay. In situations with diffuse damage to the motor cortex bilaterally in spastic quadriplesias, then you get the exaggerated jaw jerk in these children. Then you have got the most important condition involving the trigeminal nerve in lateral medullary syndrome. In lateral medullary syndrome, the area of the upper medulla and lower pons is affected because of the lesion in the posterior inferior cerebellar artery. Okay, this affects the spinal nucleus of the trigeminal, lateral spinothalamic tract. Okay, results in loss of pain and temperature on the side of the lesion and opposite to the side of the lesion in the rest of the body. This is very classical sign of sensory loss in the lateral medullary syndrome involving the spinal nucleus of the trigeminal nerve. This is called checkerboard pattern of sensory loss. That is, pain and temperature loss on the ipsilateral phase with pain and temperature loss on the contralateral half of the body. Okay, there is loss of pain and temperature sense on the face towards the side of the lesion and loss of pain and temperature sensation in the rest of the body opposite to the side of the lesion. This is called checkerboard pattern of sensory loss. This is diagnostic of lesion involving the spinal nucleus of the trigeminal nerve. Then other conditions, trigeminal neuralgia, cluster headaches, infections, neoplasms, trigeminal sensory neuropathy. Okay. Well, this is in brief about the trigeminal nerve and its clinical importance. Thank you very much for patient listening. We'll meet you again in the next class. Until that time, bye bye.